So if you're considering a deep plane facelift, stop right there. A lot of people start their facial rejuvenation surgeries by taking baby steps, starting with things like fillers and threads. But those procedures can actually backfire. They can actually make your surgery more difficult and more unpredictable. And you're gonna wanna know what those are. And for those of you who don't know me, I'm Dr. Amir Karam, board-certified facial plastic surgeon and founder and creator of Karam MD Skin. And in this video, I'm going to walk you through the things that you should avoid before getting a facelift and the reasons why and what you can do about them, as well as helping you get set up for the best possible facial rejuvenation outcome. If you haven't already, make sure you subscribe to the channel. I make videos like this to empower you to make good decisions every single week, so make sure you subscribe. First up, fillers. In the filler category, you're talking about things that will increase volume. Now, there's 3 different types in this category. There are hyaluronic acid products. Those are by brand names like Juvederm and Restylane. Then there's calcium hydroxyapatite. Those are things like Radiesse. The third category is biostimulators like Sculptra, and they stimulate collagen. But all 3 of those are used to basically get in front of the need for a facelift or used to buy some time before you need a facelift. But all 3 of those can have very negative effects on your facelift when it's performed later on. So how can these directly affect a facelift? Number 1, they leave a footprint and a portion of that filler is there forever. The hyaluronic acid fillers, which are supposed to go away in 6 to 12 months, actually don't. Products like Radiesse, they stay in even longer. And then you have products like Sculptra, which build collagen nests throughout the tissue, and they can stay even longer, up to 4 years or plus. In fact, some fillers in studies have been shown, even the hyaluronic acid variety, that have been there 10 years or so after the filler was injected. So what does that mean? Well, number 1, it means it starts to change the look of the face. So if the goal and idea is that you're gonna look like you used to, turn back the clock and look like you did when you were in your 30s, well, getting something done along the way that is pulling you further and further away from what you used to look like, because anytime you're adding volume to, say, lift the cheeks or build up the jawline to hide the jowls, those things are areas of volume that your face did not have when you were in your 20s and 30s. They're newly introduced, and over time they start to build up. The cheeks get bigger, the jawline gets broader. Eventually your face doesn't look anything like it did back when it was younger. That's one aspect. It's the deformity that's formed over time. Second aspect of it is that all of these fillers and biostimulators, wherever they're injected, they leave some level of scar tissue. Scar tissue is a byproduct of your body trying to break down hyaluronic acid products like Juvederm and Restylane, because it's, at the end of the day, a foreign body. Same goes for the calcium hydroxyapatite variety, which is Radiesse. Your body sees these things as foreign bodies. So as a result, it wants to break it down. That breakdown process is inflammatory. That inflammatory process leads to scar tissue. That's simply the cycle that happens at the soft tissue level. Product like Sculptra basically stimulates the production of collagen. So what you end up getting is in and throughout the tissue beds, you get little nests in areas where collagen is formed, and these form across the layers of the skin and oftentimes leave it there even years later, making it significantly more difficult to dissect and travel through the tissues when you're doing a facelift. And that is also true for the hyaluronic acid products as well as Radiesse. What ends up happening, what I see when I go into a surgery with patients who've had this in, everything is significantly stickier. The tissue planes are significantly more obscured. What that means is that your surgeon who's trying to perform a very delicate operation, like a deep plane facelift, which is considered the most delicate and most anatomically sensitive type of surgery you could do for facial rejuvenation, but also has the greatest rewards in terms of most level of correction as well as the longest lasting. So it's a wonderful technique to use. Don't make it harder on your surgeon, because not all surgeons do this day in and day out the way I do. So I'm used to seeing this when I get into a face that has some fillers or Sculptra, etc., and everything is obscured. I have experience in navigating through that and carefully and safely separating out the tissues, avoiding hitting the facial nerves and other important structures like facial muscles, etc. But not all surgeons have the benefit of experience as I do, and unfortunately, this makes your surgery way more challenging for the surgeon, both in terms of the time it takes, but also the level of correction and result that he can achieve. Not to mention that even when you take the face and put it back into the positions that you are trying to achieve with your facelift technique, all that additional volume gives you cheeks that you've never had, gives you a jawline fullness that you didn't have. So things look a little off and you don't necessarily return back to that look that you had when you're in your 20s and 30s, which is intellectually and emotionally the target for a procedure like this. So bottom line, small amounts of filler here and there can be useful and beneficial, but when you start to use it to try to replace surgery or buy time, you are not really doing anything to help yourself. And I'm gonna say this again, although I've made lots of content on this very topic. Once you approach late 40s and 50s, there is nothing you can do by adding extra volume, not even a fat transfer, that will stop you from needing a facelift. All you're doing when you're starting to put fillers in or continuously adding more and more filler in as you get older, which is invariably what happens, people see their face sagging more, so they add more volume. All you're doing is making it more difficult for yourself, your surgeon, and limiting the beautiful outcome that you could potentially have if you have less filler in your face. So bottom line, fillers have a place, just not too much and not as a replacement for surgery. Next, heat-based energy treatments. So what are these? These are procedures like Morpheus 8, Ultherapy, Thermage, and a ton of others that have different brands but use heat as a way of tightening up the soft tissues and basically, again, being a potential substitute for a facelift. In my practice, I've made a decision not to include these particular devices because when I weigh the level of correction, which is usually very minimal, relative to the cost and the potential risk, which I'm about to share with you, they usually don't meet the test. So as a result, I don't want to offer something that is not going to satisfy my patient's expectations, but also knowingly cause issues down the road when they do invariably and inevitably want to do a facelift. So the idea here is that you are trying to put heat at the deeper levels below the skin where the fascia is so that the fascia tightens and some of that jowling and the neck laxity and all those other things start to improve. But you gotta remember, heat in tissue is not a great thing because not only does it potentially melt and have problems traumatizing the facial fat, which is directly under the skin. This subcutaneous fat is like the padding under the skin that creates that suppleness and beauty and youthfulness to the skin. And by putting heat into it, invariably can risk some of that fat and thin it, which has been anecdotally discussed for years by patients who've undergone these particular treatments, that they felt that the procedures actually aged them. But what we also can see sometimes in these cases is patients who've had extra treatments in these areas, the tissues can be scarred, they can be a little bit traumatized. And anytime you're separating skin from the deeper fascia, that plane needs to be done delicately. Otherwise, you could potentially rip the skin, you could devascularize the skin, etc. And ultimately, at the end of the day, anything that makes surgery more difficult in terms of dissection, which is the separation of tissue planes, is something you want to avoid because your surgeon, again, is going to have a hard enough time doing this well for you, and you don't want to make it harder on them for no good reason. Again, if there was a significant upside, I would be all in favor of it. I would offer that to my patients. I would say, you know what, it's worth the risk, etc. But if there's just risk and very little upside, then you're just basically taking on risk for nothing to exchange for it. And by all means, if you guys have had these treatments and had great results, then by all means share them. And if you've had experiences that are consistent with what I'm describing, please do share. This is a community. We want everyone to learn and hear about these things through each other. In a nutshell, any procedure that uses heat to tighten up tissue, in my opinion, not a great idea and should be avoided. It's from clinical experience of doing this for over 20 years and hearing from literally thousands of patients who have had experiences with these treatments, but also my colleagues who do these treatments. So my opinion is pretty firm, but it's also quite objective because if they worked, once again, I would offer them in my own practice. Let's talk threads. Threads is an interesting story because when I first started my residency and fellowship, they hit the market in a very, very big way. There was a company called Contour Thread Lifts, and this took the industry by storm. They were barbed permanent sutures. Everyone, surgeons, non-surgeons, etc., were using these for people who basically opted out of doing surgery. So it was a wonderful potential opportunity to help people who weren't ready for surgery or didn't want surgery. And the idea was you're sending threads in through the tissues, you hike up the tissues and they get caught up onto the threads and it lifts the face. Even I tried this a couple times with some of my patients in fellowship, and immediately I was surprised at how painful the procedure was for the patient after the threads were set, but also how limited the changes were once everything kind of settled again, because the tissues don't want to necessarily stay there. And you're not really lifting the fascia, you're more lifting the skin, so you get bunching in different areas and things just didn't look quite right. And so I chalked it up as another one of those, gimmicky, no good type of treatments, even though I was in literally fellowship and learning, it just didn't make any sense to me. And then shortly within a couple years, the company actually, I think, either went bankrupt or disappeared somehow, but the fad was over. And the fad was over because it wasn't a great idea and because there's a lot of complications related to the threads. There was problems with infection, contour deformities, irritation, pain, all these different things. So it went away for a long time. And then just recently, last, 5 years, maybe 10 years or so, it came back in the way of dissolvable threads. These are the PDO threads. Now, PDO threads come in a number of different varieties. They're the type that people are using underneath the skin to stimulate collagen, and there's also those that are being used for lifting. All of them fall under the same basic category. They are short-lived. They don't give significant changes or results. Obviously, they cost something, so you're spending quite a bit of money on these. And at the end of the day, all those complications that I just mentioned still apply to these with very little upside. At the time of surgery, unfortunately, we see scar tissue, which again makes dissection difficult because your body is, once again, breaking down these PDO threads. They're dissolvable, they're a foreign body, your body's trying to get rid of them. What's left behind is scar. In addition, once in a while, you get cases where these things erode through the skin. They end up causing problems, infections, etc., which makes even more scar tissue and it makes it even more difficult to separate the tissues safely. So again, you're going to have a facelift if you've got jowls or neck laxity and ultimately want to address it. There's no other way around it. By doing these type of procedures, you are once again making it more difficult on your surgeon to do this in the best possible way and give you the best possible result. Now, I take myself into a position where I say, I do this so much that I see so much, I'm comfortable with these cases, but not every surgeon is. And you want to make sure you line up the cards in your favor and give yourself the best opportunity to get the expected results with the least possible problems or challenges. Okay, so here are a few other things. They're not necessarily procedures, but things that you want to avoid, bonus tips that you want to avoid if you're considering having a facelift. Just keep these in mind, and most likely your surgeon will prep you for this. But number one, if you're a smoker, you have a higher chance of vascular issues and insufficiency and causing sloughing and skin death. So make sure you start to wean off and eventually quit smoking if you're considering having a facelift. Number two, at and around the time of the facelift, make sure you avoid all types of supplements that can make you bleed, including things like turmeric juice and ginger and all these other things that may be in your normal smoothies, etc. These things can all lead to hematoma and potentially cause problems with complications related to surgery. So these are just to name a few things that that have nothing to do with procedures that you're doing, but they could potentially cause issues. What are things that are totally safe to do and that you should do to improve your potential outcome when it comes to surgery? Well, number one, anything that you can do to improve the quality of your skin is going to give you a better surgical outcome. I can't stress this enough. For example, sun protection is huge. Sun is an accelerator of skin aging. You're going to lose collagen, elasticity, sunspots. So even if you tighten the face, a face that has, crepey looking skin and filled with lines and wrinkles isn't going to look as good as skin that is healthy looking and is rejuvenated and fresh looking. This is the goal. You want to go into a facelift with the best possible skin. So focusing instead of threads and fillers, Ultherapy and Thermage and Morpheus 8, etc., instead focus your time and energy and your financial resources towards improving your skin. So what are those steps? Number one, sun protection. Number two, get yourself on a solid anti-aging skincare regimen that includes big time actives like retinol, vitamin C, niacinamide, peptides, and then botanical lighteners, etc., to decrease pigmentation. Oils and lipids and all these things are going to improve the quality of the skin. Hyaluronic acid is going to improve the plumpness of the skin. So all in all, what you're going to see if you're using actives is day in and day out, your skin's going to get better and better. So month over month, as you're waiting for your surgery, year over year, your skin's going to look amazing. In fact, this is the #1 reason why I got into this game of skincare. What I realized was the options that were available for my patients were not great. They were either too complicated, too many steps, too harsh. So I developed the Karam MD trifecta for this reason. It includes all those big name actives that I just mentioned. It's used for sensitive skin and all different skin types. Makes it super easy, 3 steps. On you go. Almost every one of our surgical patients is using the trifecta before their surgery and after surgeries. You can see all these beautiful before and afters. Their skin, complemented by the changes that we create surgically, lead to an incredibly youthful, balanced, and natural look. To me, there's nothing more sort of off than having a tight face with a bunch of lines and discolorations, because that's not what youth looks like. So this is an important consideration. Focus on skin. Procedures that are good for your skin, things like microneedling, things like chemical peels, and even light laser peels. These are all safe and good for your skin to improve it so that when you do have a facelift, you're in good shape. One more thing, Botox, completely safe to do before a facelift, and something that I highly recommend you do it in addition to your skincare. Again, preventing lines and wrinkles from forming in the upper face will complement the beautiful outcome that you'll get once you have a deep plane facelift. This is exactly the recommendations that I'm giving you, is the same recommendation, the same playbook I used with my wife. So for her, starting in her mid-20s, she got started on a skincare routine that included all the actives. Now, almost 30 years later, she is doing the trifecta exclusively, all the same actives, but she's been dedicated to her skin all the way through. We did a fat transfer on her when she was in her late 30s because she lost quite a bit of volume after the pregnancies. We had 4 children together, and we did a fat transfer one time. No more fillers, etc. after that point. Botox every 3 to 4 months, skincare, that's it. No lasers, no chemical peels, nothing beyond just basic skincare. Then she has a facelift at 52, back to skincare, that's it. So all of these little treatments that are available, I could have done for my wife. My wife could have had threads. She could have had, all these things, but again, we chose not to. Why? Because we wanted her face to be as natural as possible. Now she has a beautiful, normal looking result. She looks like she did when she was in her 30s. We're very, very happy, but again, this is how I advise people. I advise the way I advise my own family members, the way I advise my closest friends. So this is where this information is coming from. So skipping threads, skipping fillers, and those type of deep energy device treatments, in my opinion, is going to make your life a lot easier. You're going to save a lot of money. You're going to have a better surgical outcome, and your surgeon will thank you. All right, folks, so whether you're just curious about facial rejuvenation or seriously trying to plan for your future facelift procedure, I hope this information has given you some guidelines in terms of potential paths that you can take to get the best result with the least amount of potential complications and also the least potential amount of risks and costs. And for those of you who want to take a deeper dive, make sure you subscribe to the Karam MD Journal. The link is below. And if you haven't already, make sure you subscribe to this channel. And if you have any questions or any comments, make sure you drop them in the comments below. Until next time, Dr. Amir Karam.